Welcome, dear viewers, to our format of Natural Medicine. The topic of today's program is circulation problems. But when do we even know that we have a circulation problem? Or do we only know this from the consequences? And what consequences could that be? I heard today that it can definitely be tinnitus or macular degeneration and possibly much more. I would like to discuss this today with a wonderful exceptional physician who has come from Saarbrücken, and you will get to know him in a moment. We'll get started soon. Stay tuned. Yes, and here we are again, and now I would like to introduce you to Dr. Met Harald Burgard. Great honor. Thank you very much, dear Harald, for being here.
Hello, Alexander, good day.
I can learn a lot from you and I am extremely grateful for that. Many thanks for the many last programs, starting with gold implants, which I am still talking about now. That you are actually able to avoid an orthopedic operation with gold implants or to cure pain with arthrosis, so that you really have a lot of comfort in life again. That will remain an eternal memory for me, and I am your biggest fan. But let's go to circulation problems today. Is that something that affects many of us?
Look at the numbers of people who die of heart attacks and strokes.
Is that always in connection with circulation problems?
Yes, high blood pressure is the most common thing that damages your vessels at some point, which then results in blood clots in the legs or a stroke, tinnitus, vision problems, macular degeneration, and much more. These are just long, decades of vessels burden, which we will talk about in a moment, which lead to such diseases and which kill people.
Let's start with tinnitus. I mean, that's a big topic right now. More and more people have this tinnitus. And I've never heard of a connection with circulation problems. Never. And that's why I find it very important and revolutionary what you're saying right now. Is tinnitus in connection with heavy metal loads?
You can get tinnitus once you listen to way too loud music and your hearing cells are twisted and broken. What many older people experience, or what you then do when you have systemic stress, is that the vessels are damaged. And whether that affects the little ones or the large vessels in the heart, that depends on the individual. Basically, it's like this. A circulation or any organ can only live when blood arrives there, when oxygen, when nutrients arrive there. So it is important that our blood vessels are permeable. If they are burdened by various causes, they will get sick at some point. And the question from earlier, can heavy metal do that? Yes, heavy metals release damage to the blood vessels in the body. Heavy metals can increase blood pressure, such as lead. Heavy metals can form free radicals that oxidize your fats. You know, fats swim in blood. We know this bad LDL cholesterol and the good HDL and so on. And when these fats that are in the blood oxidize, so quasi, in the car you would say the mudguard rusts, when they oxidize, the eating cells take these damaged, unusable, useless fats and stupidly store them in the blood vessels. We've seen that in books 100 years ago. You saw that the beginning of the vessel calcification are the so-called foam cells. Today we know that these foam cells are basically macrophages, i.e. eating cells that have absorbed oxidized LDL. And that is stored in the vessel wall. Then with time, inflammation processes arise, which then lead to vessel calcification, to atherosclerosis. And that can affect the large vessels and then cause a heart attack, a stroke, or the small ones. And tinnitus, macular degeneration, and much more.
That means macular degeneration is also always with the vessels that are clogged or even close.
These are inflammation processes in the vessels that cause the vessels to take damage, that they close, that through the inflammation, but also liquids that emerge from the vessels, form around the vessels. That is a mix of inflammation, of autoimmune reactions, triggered by toxins, heavy metals, light metals such as aluminum, toxic metals such as arsenic, or even by chronic infections that are caused by pathogens. As we have just heard in other programs, Epstein-Barr, toxoplasmosis, everything that causes chronic inflammation can lead to such things.
I already understand that, but I still haven't quite understood the ear whistling, because isn't that also a problem with blood circulation? That suddenly an ear, let's say a thrombosis, forms somewhere, or that an artery to the ear is slightly narrowed, that this can cause whistling.
Yes, if you imagine, the ear is circulation, like your heart, like the kidneys, with much smaller blood vessels, because there is less space. If such a small blood vessel closes due to an inflammation, a slight swelling in the inner cell area is enough. Then it leads to blood circulation reduction and thus to tinnitus, or to blood circulation stop and thus to a hearing loss.
I know a lady who had a colonoscopy and then she had tinnitus. And this problem is no longer brought away, but you were in a full narcosis. And in a full narcosis, I am totally driven down, I sleep, I assume the whole blood circulation goes down, and could have caused a thrombosis in the ear, which then causes this whistling.
So I think it's very unlikely to cause a thrombosis. If you have for example, a colonoscopy, for whatever reason, it may be that the manipulation or the existing basic disease simply increased the inflammation status. And any inflammation can lead to arterial vessels being worse bled. So that could have been an inflammation thrust. You don't do a big full narcosis, you give a little propofol or dormicum, that people are just so sedated, but that's not a deep full narcosis. But always when inflammation in the body goes up, or when the fibrinogen level rises in inflammation, or when too much iron is stored in the body due to chronic inflammation, then it comes to processes, which we call freer formation radicals, or with a high fibrinogen, the blood simply becomes thicker, does not flow as well, and that can cause damage, especially where an organ is already damaged. We can also measure whether you have an inflammation in your blood vessel. Lipoprotein lipase PLA2, for example, is a blood value. If it is high, then there is always an inflammation in the vessel's inner wall, and not anywhere else. Then you can ask yourself the question, where does that come from? Then we have to go through the search and see that we eliminate the cause so that the inflammation goes away.
But you find it in the blood that it is there, but where is it? On the knee or shoulder, on the ear or where? That's the question again in the end, isn't it?
We don't know that yet. That's like the CRP value is high. CRP, C-reactive protein, has been a classic vessel marker for years. Just like homocysteine, if that's high, like lipoprotein, if it's high, and several others. These are inflammation markers that show us that something can happen to the vessel, but they don't tell us where it comes from yet. Then you have to go on the search. I then go and see what toxins the person has in his body, what heavy metals he has, is his gut disturbed, does he have leaky gut syndrome, is there a high heavy metal load that leads to it, or does someone have a chronic borreliosis, has a toxoplasmosis, whatever. So this huge complex has a toxic load with glyphosate, someone has a toxic load with PCB, with paint, whatever. Has a high circulating immune complex that causes inflammation in the vessel. All of this can then be found out if you search, and if you get rid of it, the problem is also gone.
Let's go back to this ear again. So there is an ear swelling, an inflammatory process and a swelling that does not allow a certain kind of circulation. And that's why this ear whistle comes. Can you now, for example, also produce something directly on the ear with neural therapies? With procaine, the inflammation processes should be reduced.
Yes, you can work with all the procedures that are able to create relaxation in the neuromuscular and in the vessel area. So if I now do a procaine injection on certain points on the ear, then I can bring relief there. I can go there and do a procaine base infusion to also treat it from the inside. These are diverse possibilities to act briefly. But if I have a vessel inflammation, then that's always a process that goes on for years and decades. I have to act differently. We have seen, the so-called TACT study in the USA in 2013 also showed very clearly that with chelate therapy vessel stress, vessel inflammation, vessel calcification can be significantly improved by reducing the triggering metals.
I understand. But that goes on forever until I ultimately have an effect up here on the ear purely through chelate extractions. That's why my question is to inject directly into the ear. I mean, an ear pipe has to be terrible if you experience that.
Yes, so if someone has acute tinnitus, then you can also go there and do that, for example, but the HNO doctors do it with a thin needle through the drum cell, through cortisone into the ear as direct anti-inflammatory measures. You can use the admission of EDTA gelatine extractions to reduce free radicals very quickly. You can improve the flow rate of the blood very quickly, which then reduces the whole thing quickly. You can use the apheresis, the environmental apheresis, where we have special filters to remove toxins, of course, to improve the flow rate of the blood very quickly. But again, this does not occur just now, of course, the acute situation, but such diseases occur over years and decades by a permanent inflammation. And there is a Hagen-Poiseuille law, it's called. This is a law that is used in tubes in so-called uniform flow. And it's interesting, if I have a vessel calcification now and I want to improve the blood flow in an artery, then the Hagen-Poiseuille law says in these flows, if I only increase the diameter by 10%, I have 100% more flow. That means, if I treat someone who has a blood flow disorder somewhere and I achieve that the vessel swelling of the intima or whatever is there, that it goes back by only a few percent, I can already achieve a significantly improved blood flow. And that's actually what we see, that we can help people by taking out metals, by lowering free radicals via chelate, by lowering the flow ability, the rheology, the lowering of fibrinogens with the apheresis, etc. So in other words, we have to get rid of all this inflammation clutter. Once by pulling out the right inflammatory mediators, but also by eliminating the causes. Pathogen, borreliosis, heavy metal load, etc. Because these are the things that make you sick in the long run.
Another thing, also tinnitus seems to be a popular disease to me, but I also see this macular degeneration at the eyes, so a huge popular disease. And every time I talk to you about these topics, we always come back to these environmental toxins. Is it really just so far that the barrel of us people here in Europe is just really slowly full of toxins, and it just overflows with some in the ear, the others in the eye, and with others with high blood pressure, and so on?
Bei den einen am Ohr, die anderen am Auge und wieder anderen mit Bluthochdruck und.
Well, it's just the way it is. The more you store in the stuff and don't stop it, the more you burden your system. And if you now belong to the people who have a low tolerance threshold, who don't tolerate much because the detoxifying enzymes don't work properly, because you react very strongly to inflammatory stimuli genetically, etc., then you get sick faster than your neighbor. And the amount of load at some point leads to your tolerance threshold being cracked. And then you get sick. One of them gets vessel sick because the family member may react more with vessels, the other one gets diabetes, the third one gets cancer, and the fourth one gets something, I don't know what. Rheumatism, for example.
Something else about these vessels. I once heard in a program that you should take vitamin C highly dosed on a regular basis. We're talking about 2 to 5 grams. This doctor said, where the vessel's stiffness seems to increase, elasticity increases. And due to an elasticity, it is sometimes possible that if a thrombosis occurs, that it just goes through and doesn't just get stuck, and the vessel then closes, and a heart attack or a brain infarction could be the result. Is that also your point of view?
The higher the vessel's elasticity is, the better it is always. In the course of life, due to a chronic inflammation of the vessel wall, due to high blood pressure, due to high blood fat, etc., at some point a certain vessel stiffness occurs. We measure this with every patient. We always look at each patient with a 4-point measurement first. How is the arterial flow? How is the vessel stiffness? So that you get an impression of what's there. The stiffer a vessel, the worse it is. The more elasticity there is, the more space can be created for the case of the cases. But a chronic inflammation that leads to arteriosclerosis can in doubt lead to if your blood is not liquid enough because you just sweated a lot, because it was very hot in the summer, because you were extremely stressed, because you had a lot of stress, because you just smoked 5 cigarettes in a row. That's just the artery. The artery closes and then it leads to acute blood clotting. The arteries, compared to the veins, also have muscles that can also get cramped, which contract depending on the situation. And if there's not much room anyway, then it's often enough that it leads to an acute situation. That's one of many mechanisms. But in general, you always have to make sure that the person who is at risk there, which you can see early on, that he is freed from the inflammatory triggers that pose a danger. And that's something that we don't look at in cardiology or at the GP. You don't look at homocysteine, you look at the CAP value, but you don't look at many other things. And they can then, like lead and mercury, and so on, have a dangerous effect. And the more things come together, the higher the risk that it hits you. In the vessels or wherever.
What I learn and hear more and more from such medicine as you are, is that all these environmental impacts lead to more and more people getting sick, and these barrels are massively overflowing. So the cause is these environmental impacts that we either get under control through regular doctrinage, or even better, we want to prevent these pollutants from entering the environment. Because we're only looking at ourselves now. I mean, the environment is also our plants, our animal world, our so on. So we destroy everything everywhere.
Yes, that's the problem. I mean, if we tip microplastics into the sea, it ends up on our plate. If we throw away mercury, it ends up on our plate at some point. And then we have it in our body and then it damages our microbiome, so our various bacteria, then it damages our cells and so on.
What did I hear again last week? Now nuclear power in Germany is getting green.
Yes, that's interesting. I'm always amazed by these things, but yes.
You can't get out of the amazement, can you? So somewhere where money flows, there's energy in it and everything is good and great. And you shape the truth as it is. But the truth is simply that a lot is saved. Everything is produced cheaply and quickly and not for our own good.
Yes, and then it's just about preservatives, with antibiotics, with other things that provide an optimal yield. But all that is good for the economy or for the machines that have to process things or is for the machine that ultimately needs it, namely your body, under certain circumstances bad. Not for everyone, but for many. And we see that there are simply more and more chronically ill people. And there we have a combination of electrosmog, of stress, of many factors, of toxic pollution, of wrong diet, of eating too fast. Whatever, and at some point people get sick, but then you usually go to the doctor and he gives you a pill. That may solve your problem in the short term, but not in the long term. And then you get a heart attack, diabetes or something else. And people wonder and say, that came out of nowhere. But that's been going on for 10, 15, 20 years. You just don't notice it. And if no one looks, no one notices.
I would like to take this opportunity and ask you what your view is on the subject of electrosmog. Because for me it's actually nothing more than microwaves. And the more microwaves, if we all sit in a microwave, which is definitely 5G or 6G in my opinion, then it can't necessarily lead to biological life, can it?
Well, I mean, electromagnetic waves that are emitted are electromagnetic waves. And if we look at how our communication in the cells works, then it also works via electromagnetic waves and electric shocks, via saltatory stimulation, whatever we call it. And we know, for example, that certain frequencies are able to cause calcium shift in the ion channels, where substances have to get in and out of the cells. And if there is a shift and deregulation, then at some point the cells don't work properly, and at some point bunch of cells, and at some point a whole organ, and at some point a whole organ system. And at some point the person just gets sick. We also see that electromagnetic waves, similar to microwaves, can warm your food. Of course, when you're on the phone, you can also warm brain cells, ear cells, etc. And we also see that the higher the frequencies are, so now with 5G, it's much stronger than with 4G and others. These are all things we see. We just saw that the Americans have postponed 5G, the introduction of 5G, because it massively disturbs air traffic. So you can measure it there, because the measuring instruments show it. There are no measuring instruments in the body that show it, so it's hidden. But this electrosensitivity, which many people suffer from, that's not imaginary. That's actually a reaction of these people to these environmental influences. And you can only say, you should try to protect yourself as best you can, by not, for example, not having your phone at the ear for so long, by turning off the Wi-Fi in the evening, by taking a radiation reduction as much as possible, by not leaving your cell phone next to the pillow, and so on. So just try to get a little protection for yourself, because you can't protect yourself globally. It's now introduced in such a way that when I drive down the street today and turn on my cell phone, I have 20 optional Wi-Fis that I can log in. And that's just a small part. Then there's all the TV, the radios, then there's other radiation, and so on. Well, that's become enormous by now, but our body has to deal with all of this, plus the toxins, plus the pathogens, plus.
Yes. So not a nice development in this area. Again, on the problem of circulation. So the consequences, the disease of a circulation problem, the disease that can break out of it, can be tinnitus, it can be macular degeneration, all eye diseases, all circulatory organs in the eyes, up to the heart. What else is there?
Heart attack, intermittent claudication, the so-called peripheral arterial, where the leg circulation is bad at some point. There are people who just stop every 100 meters. And then they have to wait a little until the blood runs again. And then it goes again 200 meters, and then they have to stop again. That's called PAVK, intermittent claudication disease, just like when you go window shopping. Go, stop, look, go on, that's how they run around. These are diseases that affect the arterial system.
So also detoxify immediately, so that the blood actually is no longer so thick, but becomes more fluid?
Yes, just so once, we have multi-layered processes, so that when the inflammation, which is triggered by free radicals, so metals cause free radicals and other substances, so that these things get better. We have, for example, again and again patients who come and have a chronic inflammatory burden, for example with chlamydia pneumonia. We have known from them for 5 years that they also store themselves in the vessels. And when I see that and do arteriosclerosis, when I see that someone has such a chronic inflammatory burden with this pathogen, then I have to treat them. When I see someone comes and has high blood pressure or has already had a heart attack or has a blockage somewhere, then I look at what metal burden he has, what pathogens he has, what toxins he has, what inflammation is already running there, so that I stop that as far as possible, as well as possible, as quickly as possible, so that the process comes to stagnation.
I am totally fascinated. I think your waiting period until you have an appointment with you is easily 6 months, right?
Yes, so you have to wait a little, yes. 2 months, I think, maybe a little longer, but we'll see. It always fluctuates a little.
That's why it's so important that you spread your knowledge here today, so that many more people have the opportunity to absorb this knowledge and that it spreads a little more. And I would like to say thank you very much. I haven't had the connections of eyes and ears with the circulation yet, I have to be honest. Yes, now it would be a lot clearer to me. The person I'm looking at right now with tinnitus, she's been doing it for a long time, also an apheresis, i.e. blood washing, chelate, the whistling is still there, but omega-3 is also taken very often, anti-inflammatory. I could just now introduce this neural therapy right on the ear.
So with tinnitus, of course, you always have to see if he can be due to circulation, but it can also be that this person was exposed to constantly high noise and then simply damaged the hair cells in the inner ear, and then it's just a damage of the hearing cells and you can't fix it. So tinnitus, when it occurs, best treat as quickly as possible, because if it runs for a long time, then it gets difficult. And what you have to say to young listeners, we have found, that means not we in my practice, but in studies, that young people have more and more hearing impairments because they run around with earphones the entire time, and that already 25% of the 20 to 30-year-olds suffer hearing impairments. And if that happens, if it has occurred that you have damaged the hearing cells by too much volume, this is an irreversible process. You can't fix it. There are broken cells, that's like fingers off, it's off. And if they are broken, they are broken. That's why, if you hear volume as little as possible, if you hear with headphones as rarely as possible, and if only that loud, it is absolutely necessary. Otherwise you damage your hearing.
So headphones are fine, but not if it's too loud, right?
Headphones are fine, but not too long. If you work with headphones for 5 to 6 hours a day, that's not good. And above all, young people tend to use them too loudly. They like loud music and then they hear it over the earphones. That damages your hearing sustainably, and that very early. Some studies 3 or 4 days ago, the publications were shown again.
I've already said that in all these concerts and techno parties and so on. How often music is heard so loudly that it causes damage to the hearing? But that's pretty clear.
We've known that for many years. But now it's like this, no matter where you look, everyone has a plug in their ear. And then they hear loud music and hear it for hours a day. And that's bad for the ears. Apart from the fact that it also leads to an acoustic orientation. If the plugs are constantly in your ear, you no longer differentiate between the sounds you have to filter out, the concentration gets worse and so on. These are all factors that we now know. That's why you can only say, you can do that. That's also comfortable. But as always, with measure and draw.
Thank you very much. Doctor. Harald Burgard, was that for you? Burgard, sorry, I said Burgard, was that for you? Dear viewers, we see that. It's shown in the stream. The name is clearly formulated. Thank you very much again for looking at the topic of circulation problems with us today. And you see, we can do a lot. And again, the topic is just to take the pollutant out of the body that just doesn't belong there. And suddenly a lot gets better. Even the eyes and ears are also part of what leads to simple stupid problems in these zones that we all don't want. And I sincerely wish you, dear viewers, that you don't have that. And if you do, that you succeed with an apheresis, for example, a chelate extraction or a professional detoxification by your experts on site. And if you are looking for a good expert, then I learned today, we can always Google for clinical environmental medicine. Because that's their area of expertise. To make this detoxification really professional. All the best on your way. See you next time and take care.